back to Olympic Coaching. Today we are going to target the QL. Okay, this is part of like what happens when you get a little bit of mid to lower back pain, or if you're getting a little bit of stiffness here that really limits your trunk rotation. It can be a part of this whole complex of the hamstring to glute to low back pain that you get or stiffness that we're getting. So we're going to release this by targeting the QL. We're going to use a foam roller. You want one that's pretty dense and firm and it's got some grip on it. Okay, so what I'm going to do here is I'm going to lay down over this. I'm going to target just underneath that last rib. I'm going to come at it from the side. So from here, I'm going to lay down on top of this. And right now, I'm just going to kind of let my body know that I'm coming. So I'm going to pull myself forward and back. And so if you come directly from the back side, you're not going to hit that QL quite as effectively. I like coming at it from the side, so you can kind of push and pull from the side of that tissue all the way into the spine. So I'm just kind of letting my body know I'm coming. I'm just underneath that last rib, just underneath my rib cage. There's that gap of tissue between your rib cage and your pelvis. That's where we're keeping that roller right now. And so I can kind of rotate into this. I can rotate all the way over, almost to the front side, and I'm going to rotate over to the back. If you're in a spot that's really uncomfortable or already here, then all you got to do is stop, and when we're going to practice our breathing here. So I'm going to inhale through my nose to give my brain a signal that this is okay, it's normal. I'm going to inhale 4 seconds. Hold that 4 seconds and contract the muscle that's against the roller. Hold that nice and tight, and then exhale. Let the muscle relax and count to 8 seconds. Really, the timing isn't totally exact, but the goal is to exhale for twice the amount of time that you're inhaling and holding there. Okay, so, and then you just kind of keep moving here. And if I want to add more pressure, if you're ready to do that, then all we got to do here is now I'm just going to slide and let my body fold over this roller. Okay, we also do this mobilization with a ball. It's much more targeted, but with the foam roller, it's a little bit more gentle. It's great for doing like a warm-up before you're going to do some major pulling or hinging to get your back a little bit loosened up. So I'm just adding a little bit of motion here. I'm making sure I can breathe in this position. Nice deep breaths, and just let your body relax. With each exhale, see if you can actively try to relax your body. Try to let your muscles release that kind of protection they're trying to give there, and let it really deepen that massage into your QL there. This should feel really good. It should feel really nice to kind of massage this. And I'm just rocking my hips forward and back to let my body kind of roll toward and away from my spine here. This feels really good. Okay, if you feel a spot that's really sensitive, you're like, oh, well, hey there. I'm going to inhale through the nose, make that tight, and then exhale. And when you exhale, you can kind of let the muscle relax and add just a slight bit of rotation into that to let it roll off of that. Okay, so we just finished that side. It's just like that. We're working through. So we switch sides, and then I'm gonna stay on the elbow, get just underneath that last rib in that gap where I can hit that tissue, and I'm just gonna kind of let my body know I'm coming. You might find that one side is a little bit more sensitive than the other. So I'm just kind of letting my body know I'm coming. Add a little rotation here, finding which spots are gonna need the most attention. You might find a little bit more towards the lateral side or a little bit more closer to the spine. You feel a little bit more stiffness there. It's not necessarily tight, it's about releasing some of the stiffness. These tissues don't get a lot of attention usually, and so this is a good one to work in to make sure that your trunk is still mobile, still able to move, you're able to release some of that stiffness, and that these tissues are sliding and gliding the way that they're designed to. So I kind of let myself agitate these tissues a little bit, let them know I'm coming. And now I can just fold my body over and practice my breathing. Make sure that I can breathe in this position. Breathe into your belly, feel your belly expand. And exhale, let your body relax over that roller. When you inhale, you can make it tight. And exhale. You can add a little bit of rotation, but you don't necessarily have to. Because what we're doing is we're kind of mashing this from the side into the center of that QL. So you don't have to move. Just this pressure alone can be something that's enough to get this mobilizing a little bit. But adding a little bit of rotation and a little bit of pulling my body forward, tugging on the skin a little bit and letting it relax back can be something that adds a little bit of extra massage to that QL to allow it to release a little bit. This is huge, especially for you rotational sport players, whether it's cricket or baseball or badminton or tennis. You're rotating so much. Many of these, even in throwing type of sports or anything, that you're rotating so much that one side or both sides can get very tight on this QL. Inhale, exhale. Awesome. All right. It's all about dose response. You don't have to spend a ton of time, just a couple minutes on each side to get a nice little release. Feel your body able to rotate and twist. Feel that relief throughout the low back, wrapping around your trunk there. This is our QL mobilization with foam roller.